Hi, I'm Julia. I had pelvic organ prolapse repair surgery almost 7 weeks ago, and I wanted to bring you through some of the things that were the most useful to me after my surgery. So here they are, and also I'm on a bed filled with stuff, so let's go through it. Okay, so the first thing that I actually started doing even before the surgery were taking stool softeners and Miralax. This is a very glamorous video, as you can tell. But anyway, the purpose of that is because I think I had heard a lot of women get backed up after surgery, both from the anesthesia and sometimes the pain medications that you're prescribed. So I figured the best thing to proactively do is to front load and just make sure that I didn't get any constipation post-op, because it doesn't feel good to be constipated when you have sutures everywhere. Okay, so those are the things that I got. The other thing that I would recommend doing, as long as you clear it with your doctor and it's okay, is starting on a probiotic. I had antibiotics in my IV during surgery, and I think it's useful for everybody to be on a probiotic, but of course, clear anything with your doctor first. So those are the things that I started or recommend starting prior to having your surgery. And then one of my most used products is actually this seat cushion. It's like got this nice like webbing inside. It was really comfortable. I traveled for my surgery, so I actually flew home 3 days post-op, and this mat was a real nice luxury to have, especially because I had a bunch of sutures on my perineum and sitting was uncomfortable. So that's the other thing that I really got a lot of use out of. Also, these always discreet adult diapers, continuing the glamour, but they were really useful post-op. I actually didn't have that much stuff after the surgery that I was expecting to. But the thing that they were really helpful for was they have a really nice stretchy adhesive waistband that's very comfortable if you do experience some post-operative bloating. So I had my procedure done vaginally and not laparoscopically through my abdomen, but I did still have a lot of swelling in the area. So I found those really comfortable to wear, at least at first. And it was really nice to be able to just rip something off and throw it away, because you can't really bend when you get dressed and stuff like that. So they were very convenient. The other thing that I purchased for after the surgery to kind of deal with bloating was I got this super long like moo house dress. It's looking real good, but it was really nice because I was not sure if I'd be sent home with a catheter or not. And it was just nice to not have anything around my abdomen. So it was very comfortable. I also recommend some pants or joggers, like nothing really tight. And I would go up a size or two, just because it doesn't feel great to have stuff that's tight, stuff that's sitting there. And yeah, it just feels way better to have some loose, comfortable clothing. And, you know, don't splurge or anything, but definitely get something a size or two up. It's very, very helpful. Let's see. So regarding the other stuff that I found useful, especially post-operatively, dealing with some of the discomfort. So the topical stuff that I used was just what I used actually after I had my babies. Dermaplast is a spray that you can safely apply to the area, and it just numbs it for a little bit. It's helpful. The other thing, similar to postpartum kit, is Tuck wipes. These are witch hazel. They're really nice, no matter what you're doing in the bathroom, they are helpful. And then, continuing on with the glamour, if you do experience post-operative constipation, check in with your doctor. It's thundering outside. Anyway, check in with your doctor and see if it's okay to use any sort of a glycerin suppository. Sometimes if there's like stuff that's hard to pass and obviously you don't want to strain, these are really useful, but do not use these unless your doctor has told you it's okay, because everybody's doctor tells them different things. But I did find them helpful just when I was like, uncomfortable. Wow, this is a big list. The other thing that I found useful was UTI Pain Relief. I ended up getting a rip-roaring UTI at 2 weeks post-op, and it was nice to have Azo on hand. I also recommend getting the pH urine test strips for UTIs. It's helpful in, differentiating if you're just having bladder spasms or if you have a UTI. But of course, if you're uncomfortable at any point, call your surgeon because you need to check in. That's what they're there for. Don't feel guilty about calling them when you need stuff because they just operated on you and you had a major surgery. I always hate feeling like a burden, but this is your time to be annoying. It is. The other thing that I found helpful for some of the site swelling was these post-operative perineal cooling packs. And basically you just crack them and shake them and they get really cold and it feels pretty good on your perineum. I would say if you're having more muscle spasms, you should switch to using a heating pad. And mine looks very sad because I have used it so much. So the heating pad was really helpful when I started kind of having some spasms. The muscles that were stitched back together were not super happy to be stitched back together for a while, and I found that the heat really helped things calm down a little bit. So I just sat on a heating pad in my pad a good amount to heal, which really felt nice. So definitely 10 out of 10 recommend a heating pad. So, and I didn't have one before, so I got one for this. The other stuff was this handy dandy claw. And after my surgery, I wasn't allowed to bend down to pick things up for 6 weeks. Some doctors don't tell you anything about this, or some people don't have that restriction, but I had this restriction, and I think it was one of the hardest things to deal with because I have little kids who drop stuff and make messes and do all sorts of stuff. So the claw was really helpful with those messes and just helpful overall to remind me not to bend and ruin my surgery, because that wouldn't be good. Let's see. The other thing I think is an important reminder, depending on your doctor, your surgeon's philosophies on handling pain after surgery, some people are given more, some people are given less, but I think it's important just to have a good amount of ibuprofen and acetaminophen or Tylenol on hand before you have the procedure done. That way you don't have to run to the store. So have enough to tide you through. Also, set your phone. So depending on what your doctor tells you, whether you should, take them every so hours, set your phone timer for that, because it is so much easier to manage pain before you have it than to try and control it once it happens. So those are my main tidbits of advice. I think overall the surgery was easier than I expected it to be, and the recovery was pretty easy too. I think getting sick and getting a UTI was very rough during the recovery, but I think these products are, the bare minimum I felt that I could have used to get by and through this smoothly. So I wanted to share these items with you. Hopefully they're useful to you, and hopefully this is a video that you find useful and helpful. So thank you.